Inside Uganda's biggest referral hospital lies a quiet refuge for the old, the geriatric clinic at Mulago National Referral Hospital.
Others may come when they are very sick. Those ones who come that they are fair, they are always seen in a shorter time. Those ones that come when they are still badly off, they still need more review.
Here, medicine meets memory, and aging is treated not as decline, but as life continuing with dignity.
I was not walking, swelling legs. Now I wear shoes.
It is the only public clinic of its kind in the country, where doctors, nurses, and families walk the long road of aging together.
So from here, as we finish taking their blood pressure, we make them enter inside.
The geriatric clinic handles some of the most complex medical cases, not single diseases, but the intertwined challenges that come with age.
We receive older people, that is according to WHO definition, 60 years and above. And these older people should have what we call the older people's giants. Giants means conditions that really put the older people down, as a giant. So which are some of these conditions? Memory, that is memory challenges, forgetfulness, really total forgetfulness, not the normal aging forgetfulness. I've gone to pick a knife in the kitchen, then I forget 5 minutes, I've remembered. That is normal aging forgetfulness. But the dementia, as one of them, is you totally forget, plus the behaviors that come. Older people with complex conditions, and all these patients that I'm talking about, the older people must be referred by other doctors, because this is a specialized clinic. It's strictly referrals reasons. So far, I'm the only geriatrician in the hospital. So there are so many patients. What do I really do? I do not only sit in the clinic. The clinic is once a week. I'm supposed to do liaison services. What does that mean? I'm supposed to see all the older patients that have been consulted on, from the surgical wards, that is orthopedics, general surgery, and the divisions in surgery. Patients in other medical wards are supposed to also be seen. So if it's not strict referral, you get overwhelmed and abused, and you don't get what you ought to get. Once a patient has a referral, it doesn't matter from whether within Mulago or any other public hospital, even in private hospitals, they still refer. Go and see a geriatrician, maybe seated at this hospital. Of course, in Mulago, they come with their referral via the records, and then they're taken up.
I have Dr. Tuyabaika Joseph of Kampala Medical Chambers. She's the one who recommended me to come to this clinic. The doctor. Could not even wear shoes, not even sleep. My legs is swelling of this area. I could stay in the house throughout the day, not even walking. But since I started coming here, something has been done good in my life. Because now I can wear shoes, I can walk. Though the doctor is very strict, he tells me I should not walk without a stick. I resist. Sometimes I say, I have a strong, why can't I walk without it? He said, no, you have to come without a stick. Don't have a stick, don't come here. So I respect her word, and I found out that she was talking right. Because when you're not balancing, you have no stick, you can fall down.
So they have many challenges. Joint pains in the medical settings, in the medical conditions. They have urine incontinence, they can't control their urine. Both men and women control the poo-poo and control the urine in the medical setting. They have confusion if they've gotten some ailment. And we've talked about complex medical conditions. That means they have multiple medications. So multiple medications meaning that they come to our clinic, the geriatric clinic, so that we may optimize the medications. And then other people who have Parkinson's disease in the medical setting, they have other conditions. And then these ones who are depressed, they also come to our clinic, but they must have medical conditions. So they have also this. So they have multiple conditions. Bone mass thinning out, that is osteoporosis. We also treat that one as well. So those are some of the conditions that come to us. And the elder abuse, there is a law. Actually, the law is becoming strengthened since last year, that actually elder abuse is a serious thing. So we also see those ones and then recommend that they go to the authority and actually get sorted out. As we've been watching on TVs, several elder abuses, physically, emotionally, financially, and many other things. So there are many things that we really do. And we carry out as well family meetings for these patients patients with dementia, they have families and other issues. And also don't forget, as you see in children, you've seen we have a whole unit called Mwana Mujimu for the young ones who have been malnourished because of poor feeding or too much feeding, but mainly it's poor feeding. So even in the older people, we have what we call geriatric failure to thrive. You've seen old people thinning out so much because of many diseases, maybe cancers, maybe they are staying alone, nobody to take care of them. So such older people, they come to our clinic. So all our patients have to be referred because this is a national referral hospital. It's actually a national super specialized hospital. I'm seeing lots of dementia. There's lots of dementia. There is lots of polypharmacy. Polypharmacy means there's several drugs, more than 5 drugs that are given to this older person. But not only that, they also have drugs over the counter. We are in a country where there is no restriction. There are very few drugs that you can't just buy over the counter, and those are the opiates. But other drugs you can easily get. So someone feels a headache, goes and buys Panadol, but is not prescribed. Okay, so these people end up having several drugs. They're on Western medicine, they're also on traditional medicines. So you've really got to sort it out. So those ones, and then lots of bone joint pains and bone pains, they also come to the clinic. And we are also experiencing lots of wasted older people actually, because of medical conditions, and others because they're living alone. Living alone is actually very common nowadays with the older people because the children have relocated to the diaspora.
The thing that brought me here, it has been managed because sometimes I could not eat. But now, the medication I take I have improved tremendously, really, to be very frank. My recommendation would be that people who don't know about this should try to come here and see what is happening here. They must stay there and listen to rumors. I've never been in any private clinic apart from that one that sent me here. And I found out that that doctor was very good because he knew he cannot manage my situation. And he referred me here. I was not walking. Swelling legs. Now I wear shoes. This is my foot. It has come to normal. This one, I broke it twice in a ditch. Twice. But also it's okay. Both legs I can wear shoes.
It has been a tough and challenging journey. We came last year when Mzee was not feeling well with several number of diseases that he was battling with, arthritis, the eyes were a problem, and he could not walk. By the time we came here, he was in a state of needed someone to hold him and move with him all the time. Diabetes was so high. I don't know if that's what they call it, but it was so high, and every time he needed help. And we are glad that the doctors here have been in touch with him. Even after leaving this place, the doctors were following him up at home, checking on him, reminding him of the days he has to come back for follow-up. And yeah, we've been here, and there is a lot of improvement in his life.
Yeah, many times they look at me as a grandchild. When they walk in, when they've been referred, their expectations are to find a fellow older person. To their shock, they find someone who is much younger than they are. But I respect them. I don't call the older person by name. So when I respect them, they respect me. Then what comes out of my conversation with them makes them believe, yes, she's the right person to treat us. So with the time, they are very, very excited. When they come the second visit, second appointment, they're very excited to meet me. And then even the first time during the interview, you know, the things that affect older people are not very complex at times. Maybe they're not sleeping, she's not sleeping well, or he's not sleeping well. And you know, doctors asked about that. So they feel you're touching what they want. And then of course you come to their level. And like, you know, you're not standing on them. You're addressing them respectfully. You're looking at the other person face to face, eye to eye, and speaking simply, crack a bit of jokes. So they tell you the information. Ask them about social things. They'll be able to tell you. And actually, they're very happy me seeing them somehow, somewhere. Some of them tell you, yeah, I think we are better off with a young person who is a .com, who can research about us, than a fellow older person who cannot do so much research, is looking for man and so like. Yeah, I've faced those challenges, like they're a bit at first belittle you, but later they pick up, and I'm small-bodied, so they pick up and they love you and they don't wish to see another person.
Until this day, I've never skipped appointment given to me by my doctor. And I've never taken any medication outside there. The medication I get from here is the one I use. And it has helped me. To me, fantastic. I would say it that way. And I have no complaint at all. I would recommend, even people who don't know about this clinic should try to come and hear and see for themselves. But it is real clinic. You find her with her person here, they bring the Muza, they put you there, they take pressure, everything. Then they work on you. He also interviews you, how you feel. Sometimes they address the shot, I want to check. And listen to her command.
We need more geriatricians in the country. We are very few. We are now 3 only in the whole country. Okay? So not covering even the public hospitals, even in private hospitals. Okay? We're not enough at all. That one is one. Number 2, the nurses. We need a lot of geriatric nurses. You know, those are specialized nurses, okay? So we don't have the nurses at all, almost. I don't see any at Mulago. Though we are waiting, I'm told there's somebody who went for training but is not yet back. And that one nurse cannot be enough to cover all the entire hospital where we are supposed to see the older people. So I think we need more training, geriatric nurses, geriatricians, geriatric nurses. We need physiotherapists, you know, we have joint pains, who know how to handle an older person, not general physiotherapists. We need occupational therapists. Who are these people? They go into the homes, check the safety of the home for these older people. So we need more people to be trained.
When it comes to the establishment of nursing homes, Dr. Nankabirwa has both social and technical reservations towards embracing the practice.
So come to the nursing homes. Nursing homes, because we are now advancing, we are middle class, so we are not now advancing, the children are moving away. Of course, even if they stayed in the country, you'll be, maybe you're married or you're marrying, or you're married or you've married, whichever way has happened, you not stay at your parents' home. So our parents now lean on helpers, and you know the helpers, that's not your family. So some people, because of the rich culture we have, we find the nursing homes as something that is, balancing it is not very easy. We look at the culture. If you visited a nursing home, you wish there is none constructed in the country. You need to be with your people. They know your language. They know what you want. They know, you know, everything. Your person will be ready to change your diaper, to give you a nice meal. Jaja liked the fish this way, smoked, non-smoked, or something. But in a nursing home, you're with a stranger. And now you're with a nurse. You're with the whatever helpers. There is a lot of abuse in the nursing homes. So personally, with the rich culture, I would love that we stay in our environments. You've constructed your house, you've lived in it for 50 years, stay in that environment. Have people come into your environment, get used to them. But now, because the children have moved abroad, everywhere in the country and out of the country, so the nursing homes may be for those who are not having that support. But I believe what I saw, I would love to be in my home when I grow older with my people and maybe have a help and so like. Anyway, Uganda, we are generally kind people. We're not so bad, so that kindness comes in and you take care of the person.
Interestingly, Mr. Chalikonda holds a rather contrary view when it comes to the establishment of nursing homes in Uganda.
That one I would recommend it to be there, because now, tomorrow I'm making 77 years, God has blessed me. But my children are all bigger like you. So nobody can see. In fact, she complained that I should come with somebody, not come alone in the hospital. Then I tell her, look, madam, I have children, I've gone there. Hey, no, don't come here, don't what? A person. So I tried to do it, to listen to her. But if elderly home is there, that would be fantastic. Even me, I can go stay there. I don't want anybody's help.
At Mulago's Geriatric Clinic, every wrinkle tells a story of survival, resilience, and grace. Uganda's aging population may be growing, but so is the call to care.